We went to the ER, and on the 13th, I had double bypass surgery. And all of a sudden, I went from having no prescription meds to having a little container full of them. Fortunately, I had a really good cardiologist I met in the hospital. He's still my cardiologist. He got me into the cardiac rehab program that they had there at the hospital, in-person cardiac rehab. The focus was on the physical aspects of cardiac rehab. So spend a certain amount of time on this machine, a certain amount of time on that machine. And I got a lot of benefit out of it. But that's all it was the physical aspect. There was only one class about dietary issues, but the focus was mostly on the patients who were also diabetic. And when I saw my cardiologist again, he was, concerned that I was putting weight back on again. And I confided to him my concerns and my fears. And a month or two after that, I got the email from Recora. And one of the best things about it was having my own cardiac therapist. She could encourage me. She saw the progress I was making, and that was invaluable. The person teaching the class could see me on screen. We had our blood pressures and heart rates checked. I knew that if I felt bad, they had my address. They could send help to me. So even if my husband didn't happen to be home while I was having a session, I knew somebody would be able to help me. And if I keep up with Anya, I can do anything. And so I got my step back out, and I turned on my music, and I did my step routine. And it was so wonderful. It was just so wonderful. I can't tell you, because I thought I would never be able to do that kind of stuff again, because I was a heart patient now, right? And but Recora helped me see that heart patients can still do a lot of things, and that I am going to be okay.